Hi, welcome to this TP webinar. I am Michaela von Geijer, a dentist working here at TP headquarters in Malmö, Sweden. We think that knowledge and insight sharing is important, and we hope that you, after watching this video, feel inspired to work towards good oral health together with us. In this part of Pharmacist Guide, I will introduce you to the topic of daily oral care. I will share with you some tips and advice on how to maintain healthy gums and teeth throughout life. Did you know that 1 out of 2 suffers from gum disease? However, most people are not aware that they have the disease until the very late stages, when the bone that supports the teeth is broken down and some teeth may move from the original position. Another thing that might surprise you is that the most common human disease today is tooth decay or caries. By improving some daily habits, you can prevent both gum disease and tooth decay. My tips for adults to prevent caries or tooth decay are simple. Have regular meals and avoid sugary snacks. Drink water when thirsty. Brush twice a day with fluoride toothpaste and clean between the teeth daily. To keep gums healthy and prevent gum disease, brush for 2 minutes twice a day and clean thoroughly between the teeth once a day, preferably in the evening. Your own home care in combination with regular checkups are crucial for a healthy smile. A healthy smile is important for your self-esteem, your confidence to smile, and your ability to chew and speak properly. Research shows that gum disease affects your overall health. Gum disease is linked to several systemic diseases, for example, diabetes and cardiovascular diseases. How do you make the most out of these 2 minutes of toothbrushing twice a day? It is important to use a toothbrush that suits your needs and preferences. TP offers a variety of high-quality, user-friendly toothbrushes with extra soft or medium filaments. Angle the toothbrush at 45 degrees against the gum line where the teeth and gums meet. You should feel the toothbrush bristles. Make sure that you clean all teeth and all surfaces. Brush with small movements and light pressure. Here is a tip to make the most out of the toothbrushing and the use of the fluoride toothpaste. The 4x2 rule. Use 2 centimeters of fluoride toothpaste, brush twice a day, brush for 2 minutes, and do not eat or drink for 2 hours after brushing. To make the most use of the fluoride, try the rinsing method. Take a sip of water, wash it around in your mouth together with the toothpaste, spit it out, and do not rinse with water again. Toothbrushing, whether manual or power, is not enough. The tooth has 5 surfaces. With a toothbrush, you will only reach 3 of them, that is 60% of the surfaces. You won't access the important surfaces between the teeth, where gum disease or periodontitis most often starts. Cleaning between the teeth should be included in the daily oral care routine of every adult. It is just as important as using a toothbrush. So, what should you advise someone who comes to the pharmacy with healthy gums? Well, if there's no bleeding during brushing or cleaning between the teeth, and if the spaces are very narrow, floss is the obvious choice. TP's dental tape has a flat, wide design for thorough plaque removal and is coated with natural beeswax to glide easily between the teeth without shredding. It is freshly mint-flavored with natural ingredients. Most people know about floss, but don't use it very often because it can be quite difficult to manage. The pre-loaded mini flosser is very easy to use though. TP Mini Flosser has a bite plane which enables easy insertion between the teeth. According to studies and best practice, interdental brushes are most efficient in removing dental plaque between the teeth and reducing bleeding gums. Who should be advised to use interdental brushes? Everyone with enough space for a brush, or those who have bleeding gums. When the gum becomes healthier and less swollen, the space will be bigger and you will need a bigger interdental brush. Therefore, I recommend beginners to buy a mix pack for sizing, because it is difficult to know which sizes you will need from the start. A dentist or dental hygienist can further advise you on sizes and techniques. And TP offers 9 color-coded sizes to fit narrow and wider spaces. The wire is plastic coated on all our brushes for safety and comfort, suitable for all patients. Some advice: start with the smallest size. If it passes through the space too easily, try a bigger size. The brush needs some resistance to clean the space efficiently, as I'm showing now, but never force the brush in between, since the plastic-coated wire shouldn't rub the tooth. If unsure about the size, rather use a smaller size and lean easily towards one tooth surface and then the other tooth surface. For better access when cleaning further back, bend the wire, or if you use one of the 4 smaller sizes, bend the neck. The cap can be used to extend the handle. The interdental brush should be used with water. After use, rinse under water and let dry. When is it time to change? Take a look at the filaments. When they clump together, it is time to change. It can happen after a week or longer, depending on the size of the brush, how much it is used, and if there are fillings or crowns in the mouth. The brushes are also available with extra soft filaments. They are suitable for patients with dry mouth, sensitive teeth, or sore gums, or simply for those who prefer a softer brush. Some prefer this long and flat handle. The angled brush head can make it easier to access the back teeth or to clean the teeth from the inside. A complementary product for all patients with spaces is EasyPick, a modern toothpick. It is easy and efficient to use during the day, for instance after a meal. But for the proper cleaning in the evening, I would recommend an interdental brush. EasyPick comes in different sizes. A handy pocket case is included in some packs. Thank you for listening to part 1 of Daily Oral Care. For further information, please download the Pharmacist's Guide. I invite you to continue browsing our other videos and materials on oral health and to keep sharing.